What testing do you prefer for GI issues? The GI map stool test from Diagnostic Solutions is the one that I use a lot, and that a lot of the coaches I work with use. That's the most common if you're specifically looking at GI, but there's more than one way to notice GI dysfunction in testing. I mean, blood work's still a viable option if you're symptomatic of some GI issues, and you can look at things like white blood cells, especially neutrophils, eosinophils, maybe lymphocytes. You can potentially see that inflammatory markers, nutrient deficiencies maybe would give some indication that there's poor nutrient absorption if the person's eating adequate nutrients, but they're seeing deficiencies and they have GI symptoms, right? So those things could be indicators. There's other options. You like SIBO breath test. It's going to primarily look at, hydrogen and methane gas. It's purely a SIBO test. So whereas the GI map's not a SIBO test, but you can draw assumptions based on the fact that there's overgrowth of bacteria and symptoms, but also there's so many other things on there, right? As far as the other pathogens and potentially the ability to pick up candida or yeast, not always, but it usually will. Hopefully pick up parasites if they're in there, but again, not always. Looking at other immune markers like secretory IgA, elastase, steatocrate, looking at like fat absorption, fat in the stool. I mean, there's so many things on there that are helpful. If that's what you're testing for directly, you can use that test assuming you've already had blood work. If you have not had blood work, I'm not going to say don't go straight to the GI map, but in most cases I like to at least have baseline blood work, because we can start implementing some of these things for GI, and they're going to be super helpful. But the fact of the matter is, if you're having nutrient deficiencies and things of that nature, you really don't have the catalyst to initiate the processes of healing if you're missing building blocks in those steps. So blood work's still important.